see we have some people here for at least the first item. So we're going to get started. Thank you all for joining us. Welcome to the Board of Health meeting for today, March 16th. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, March 16th, 2022, on the Zoom platform, and in accordance with the town's policy directive and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We'll start with an attendance roll call. I'll announce your name and please reply. For members of the public, please unmute yourself when I've opened the meeting to public comment. And when you do so, please introduce yourself with your name and address when you do. So for the Board of Health, Alma Healy.
Present.
Ray Constantine.
Present.
Deb Green.
Present.
Mark Haddad.
Present.
And Jill Block, I am here. Welcome, everybody. And again, thank you for joining us. The first item on the agenda is a public hearing for the food code variance request from Asiana Management Group. This is a second request. I know that at our last meeting, we did hear a lot about this request, but I believe that neither Ray nor two of you were not here. So some of it will be familiar information and some of it will not. This variance request is, I'm sorry, so I guess Ray and Deb missed the last meeting. So this was a resubmission because we did not approve the variance request at that point because there needed to be a named person in charge. That was not identified. Whoever is speaking, I think it's Jennifer Sachs, please mute your phone, mute your Zoom, thank you. Okay, so anyway, I'm going to ask Gabby White to give us some background on this request and we'll take it from there.
Good evening, everybody. As we heard last, maybe 2 months ago or a month ago, Ace Sushi is going to be moving into the new Deborah's Next Door store. They'll have a store within a store. And the variance request is to use acidified rice rather than temperature to hold rice for a prolonged period. That's what you use to make sushi. The prior meeting, we didn't have the person in charge. I believe Min is here representing. He will be here during all hours of operation, or that is the requirement. So we are just waiting to hear how the in-store person in charge and sushi chef will execute the variance requested.
So Min, I believe then you will share that information with us, is that right?
Min was here.
He's
There
muted.
he
He's
is.
done.
Here he is.
Yep.
Right.
Min, you need to unmute. There you go.
Okay, welcome Min. And if you can let us know how this is going to work out with you as the person in charge, we'd love to hear about it, please.
Okay. So do I introduce myself?
Yeah, please let us know how this is going to work with you being the person in charge for this variance request.
Oh, okay. Yeah, my name is Min. I'm from the Asiana company. I'm the corporate chef, so I will run into the US store for the head chef. So do you have any question about the safety and, it's the right pH, anything you can ask me, I can ready for answer.
So will you be on site at the sushi bar?
Yeah, it's sushi, but yeah, I'm the chef, yeah.
So you will be there all the time?
Yes, I'm not all the time, yes.
So what are the proposed hours of the sushi?
Especially depend on the store. Only our company is 8 hours a day. So sometimes it's I have to train another it's a co-worker. So maybe they will cover for me when I got a day off. So especially I'm the main chef. So I'll be there in at least, full time.
And so if they're covering for you when you take a day off, does that mean that they become Serve Safe certified?
Yeah, everything's certified. So because I had to train them,
Mhm.
sure he must know everything about the store rule and our, it's at full safety.
Okay. Gabby, how does this sit with your concerns?
If they've identified, if Min is going to be there during all hours of operation or can train, as he mentioned, on a day off, the other person must be trained to his level. So in other words, if somebody came in or there was an issue, that person would need to demonstrate the sushi HACCP as well as any other food safety concerns within the establishment or the operation.
Correct.
Okay. So based on this, on Min being now the identified person in charge, does it meet the requirements for the variance request?
It meets the requirements. The only other piece that is pending now, because the store is not operable yet, we can't have the demonstration of this, so normally the last piece would be an actual demonstration of them preparing the rice, letting it get to room temperature, acidifying it, and then doing the proper. So I guess, Min, if you could speak to just how you do how you would do the preparation and verification process of the acidified rice. If you could just walk through that last piece, because we won't be able to have you demonstrate right now. Could you speak to that? Could you speak to that?
Okay. So it's I working with the Ace Sushi. I follow the Ace rule and regulation. So our rice recipe is 7-pound rice. We can wash in the full time, and then we ask the 8-pound rice, cook the at least 45 minutes, 55 minutes between, and then we can grab that it's rice. So we add the vinegar 32 ounce. That's me call the 7-pound rice, 8-pound water, and then 32 ounce vinegar. So we can mix this 3 times. So after this, we can make a sushi products. After I finish the products, I chill into the, it's even though cooler, whatever, 41. So, and now I can take out the display cake.
Okay, so when you are using the pH paper, how do you verify with the pH paper?
Okay, I can make with the vinegar is at 10 minutes 3 times. After 3 times, I had to test into the rice. So I collaborate with the pH meter first. And then 2 buffer solution we have, that one is the 7.0, one is the 4.01. So I take the rice and I find 4 corner and middle one. So with the 2 ounce, and then I ask the 2 ounce distilled water, I can mix with the sweeten the juice. So after I calibrate the pH, so I test into the rice.
Okay, and what's the level, the threshold for the pH?
Our regulation is 3.8 and 4.1 between.
Okay. All right, that's what we would be looking for.
Okay.
That's great. So my understanding, Min, is that you are temporarily relocating to Concord. Is that right?
Yeah, the company they put me there is a headshot. Headshot means that I had to run into there until we can find a certified franchise. So I running over there. Whatever they have applied there, any franchise, we have to train there is like certified. So we can transfer to there. It's like, wherever store approved, it's like me.
Okay. And so Karen, Gabby, Casey, is that going to cause, if there's any change in staffing, does that change any of our concerns over time if we approve this variance?
Yes.
If you don't mind me stepping in, we are fully aware that if and when it changes, that we will bring in, apply for a new variance, a new permit under the person's name. I'm sorry, Erica Cohn, Food Safety Manager for ACE.
Okay.
Yes.
All right. Thank you for that clarification. Okay. Are there any other questions from other board members?
Nope.
Okay. Then are we ready to?
I just have a question.
Sorry, Ray.
The certificate of allergen awareness training, is that something that we require, or is that outside of local Board of Health regulations? I guess that's for
That's within the regulation.
it is. So then presumably the assistant chef also will produce the certificate of allergen awareness.
Yeah, they would have to produce
all
all
have-
of it.
Yeah,
Okay.
we do.
Okay, great. Thank you.
Any other questions? Okay.
Mm-mm.
Okay, then can I have a motion to move this, to approve this variance?
I move to approve the variance.
So, sorry, just to clarify, amendment to the motion just to include the conditions that Gabby had outlined for us ahead of time.
So that is that the variance be issued only to the local person in charge for all hours of operation. That the person in charge of Sushi has to be, as noted in the HACCP plan, that it's to be permitted to and run by Ace Sushi, and that the staff of Deborah's Next Door will have no oversight of the staff employed by Ace Sushi, and that the sushi area preparation and service is a separate area under the sole control of Ace Sushi within the larger store layout. That's excluding the shared use agreement for the walk-in freezer, walk-in refrigerator, staff room, dish room, etc. So that's the addendum.
That's-
Can I add one last piece? And that is, once licensing is, this goes along with them getting licensed. That's a separate piece.
Right.
They're currently unlicensed, so
And that happens once the store is up and ready to go?
correct.
Okay. So does that then change the date that this is approved, but contingent upon?
Right. Well, I think it can become valid along with the date that they get licensed.
Okay.
Right, so approved today and contingent upon
The
receipt
license.
of
being
the
issued.
full license. And sorry, my internet cut out for a little bit, but it sounds like you heard what I said and then you read the stuff, so all good.
Yes.
So the variance will be approved with Mark's amendments. and
Or it's being
contingent
proposed.
upon-
We haven't voted yet, so.
No,
Yeah.
I know, but I'm reiterating, and contingent upon the licensing of Ace Sushi. Right, Gabrielle? Is that, you're shaking your head? Okay.
Yes,
Contingent upon the licensing of Deborah's Next Door or of Ace Sushi?
Well, it would have to be both because one relies on the other.
Right. So contingent upon the licensing of Deborah's Next Door.
Of the
and-
facility.
Of the facility. That's much more concise. Okay. All right, so do we need to restate that? Or are we
We
good?
just need a second on the amended
Okay.
motion.
Do we have a second on the motion?
I second that.
Okay, and all in favor?
Aye.
Aye.
Ray,
Aye.
Deb, aye, Mark.
hi, Mark Haddad.
Okay.
Ray Considine.
And I, Alma.
Okay, and Jill Block, it's approved. Okay,
Excellent.
thank you all
Great.
for coming. I wish you luck and when that store opens, and looking forward to it.
Thank you very much.
Thank
Yeah.
you, everybody.
Okay.
Thank
see
you.
All the best.
Okay, moving on to our next hot topic, COVID. I'm gonna speak, well, I don't know where to start with this. I can say, I'll start with where we were. You know, when we put the mask mandate in place, if you remember, our criteria was the 14-day average daily incidence had to be less than 20. And as of last week, or as of March 5th, the 14-day average daily incidence was 8 per 100,000. So, you know, certainly all of those metrics have continued to move in the right direction. Vaccination rates, I mean, there's such a small number of the general population that, you know, even as people continue to get boosters, we're still just hovering at 86% of fully vaccinated. It doesn't change that much because I think the process of everybody, those lingering people that still need boosters, in the older populations, it just takes a long time for everybody to get their second, or there's just very small numbers, it seems, that are reaching out for that. So that's, the big news on, but I mean, well, that's the good news, that things are moving in the right direction there. Currently, there's less than 2% of 14-day percent positivity. So, we're still doing pretty good, except for the next thing that we'll talk about. I think I'm still seeing a fair number of people masking in town, and I think that's always an option. I was on the chairperson's breakfast today, and they were talking about town meeting, and town meeting is going to be indoors this year, and it's going to have, they were talking, masks are always optional. They did a straw vote of all the other committee members that were there, and they were like, well, how many people want masks optional? And what I reminded people is that masks are always an option, and people should never forget that. So there might be a separate section at town meeting for people to, if they want to stay masked, there might be a separate section there for people who want to be doubly protected. But I would love for Tricia McKean, our public health nurse, to give us an update on what has changed in town since we've dropped the mandates. If you don't mind, Tricia.
Yep. Thanks, Jill. Hi, everyone. Hope everyone's having a good evening. Okay, so for people that are not aware, I will get cases from the state from labs. So anyone that tests positive through a lab, whether an antigen or a PCR, I will get the results. So some of the things I'm telling you is just the information I am getting, and this does not include home testing. And then I'm going to be talking about Peabody Middle School. So in the last 7 days in Concord, we've had 18 new cases come into Maven, with a asterisk of 11 of those so far are from the Peabody Middle School. So, and many of the cases, so let me tell you what's going on with Peabody. Sunday and Monday, we received word of many positive cases, 19 as of Monday in the 6th grade at Peabody. 11 were added on Tuesday and 4 today. So that is, well, my case counts are a little bit off, 35, 36 new cases, and 1 in the Sanborn Middle School. It's very isolated. On Saturday night, I will back up. There was a large gathering of 500 kids and parents, 200 kids and matching parents, father, daughter, parent, child dance at the Westford Regency, the Shamrock Ball that's been postponed the last 2 years. So this is a really big deal for kids. Everyone was very excited. We gathered a large group of people together indoors. Didn't have masks, had fun. Obviously the 19 people that we got on Monday couldn't get it that quickly to test positive. So as we saw all these sick calls that were coming into the schools, Dr. Hunter and I spoke. We reached out to DESE, DPH, and made the decision to get the Peabody School in masks for the rest of the week. We added 2 extra days of pool testing and offered antigen at-home testing. I feel, so today they did testing again. They did it Monday, Wednesday. Sanborn is doing it today. We'll find out tomorrow and the next day. I apologize. So the state said this sometimes happen. This happened in another town, and it took out a whole 5th grade. The good news is most of these kids have just mild to moderate illness. Some kids are really not feeling so great, but no hospitalization or serious illnesses as far as I'm concerned. I need to give a great shout out to Meg Jensen, the school nurse who is managing all these cases on her own. We are hoping that we'll get through this week once we find out the test results from the pool testing over the next couple of days and kind of see what happens. Dr. Hunter and I will gather together with DESE, DPH, and epidemiologists. We kind of all come together to figure out how to handle this. I think everyone is doing a great job. It's a little bit, scary, I think, but the teachers and administrators are doing a fantastic job trying to, do the best we can with this situation. Just so you know, so far in my counts that I have, we have 15 positive children that were at that ball, in addition to I've spoken to a couple of adults. So very unfortunate for sure. Let me see, what else do I have to tell you? A couple of adults. Dr. Hunter, when I talked to her this afternoon, she said to date, they have had Concord Public Schools 829 positives out of 3,300 kids, which represent about 25% of the kids and staff testing positive for COVID since the beginning of all this. So
At the beginning of all
March,
this,
Trish?
since when?
since the beginning,
Since the
2
beginning of
years
COVID,
ago.
not-
2020. Yeah,
Okay,
Oh,
No.
okay.
not since the weekend with.
not since the weekend. Oh, heavens, no. Yeah, no. So that's where we're at. We're on top of it. I'm talking to Dr. Hunter several times a day, and we're getting through it. So
And what I know that you've mentioned that at Peabody, they're back to masking and, right? They're masking on
Right.
Peabody and they're all the middle schoolers are masking on the bus now.
correct. Yes, thank you. Yep.
What I've seen is you shared the data that's coming out, the live data, and I noticed that between yesterday and today, that the numbers are starting to creep up at the other schools as well. And I'm assuming it's siblings. Maybe it could be everybody. I am seeing it, 2 days ago, there was nothing at Willard and the elementary schools. And then as of today, it looked like there were a handful.
That's correct. So as of Sunday, we've had 1 from Alcott, 2 from Willard. Sorry, 1 from Alcott, 2 from Thoreau, 3 from Willard, and 2 staff from Willard. So yes, definitely sprinkling. Thank you, Joe.
Right, but I'm glad that they changed the protocol in terms of masking at the school, at least for
Yeah,
now.
right. So, when something like this happens, like what can we do? Well, we know one risk mitigation tool we can do. We're going to put masks on and had little to no pushback on that.
Mhm.
So that's good. And that's what's going to happen with masking, right? And, hopefully the kids will be able to be mask optional, but when these type of things happen, let's cover up.
Right. Does anybody have any questions for Tricia on the current cases? Okay, because that's like a really great segue for this next, and we're gonna shifting things around a little bit. There's part of the public health messaging, which is a different angle of what this is about, but Pat Nelson is here, and I noticed a number of other representatives from the preschool world. And Pat had requested some input on what to do about masking with the 2 to 5-year-old population, which is not vaccine eligible at this point. And Pat, we are not, the Board of Health, we have no jurisdiction over you. We can't we're not about to put a mask mandate in there. And I know that you came to us just really looking for input on how we think about this. And frankly, as I've sat here for the past few days since you asked us this, I've been trying to debate it in my mind. And I'm just grateful that my children in their 20s and it's like not something that I've had to worry about because I realize that this is a really complicated situation that you're in. So maybe if you want to just share a couple of minutes, a brief background with us, Pat, that would be helpful.
Sure. And I totally understand that the Board of Health has no jurisdiction over the early childhood centers. However, the Department of Early Education and Care, in all of its guidelines, which basically state that individual programs should be making their own decisions using the input from their local Board of Health. So we have been so unbelievably fortunate to have Concord's Board of Health throughout COVID. You guys have, the Board of Health has been amazing. And Tricia, who's sitting here with us, and Susan really got us through the worst part of COVID. So we've always relied on the input from the Board of Health. And my families know that whenever a guideline or a protocol gets changed, or whenever we had a case and we needed some advice on what to do, or when to quarantine or who to quarantine, we've always used the resources of the Board of Health. So now we're at this crossroads of what to do about masking children who are 2 to 5. Children 2 to 5 are not eligible for a vaccine at this point. The CDC, at least as far as I know, up till this afternoon, was still saying that unvaccinated children should take that precaution of masking. So as I'm trying to decide what's going to be best for our population, I turn again to the Board of Health, but it feels like the ante has been raised, and I wanted to get the input of the board and of the Department of Concord's Public Health, as well as Tricia. It just feels like it's the right thing for me to do, since I've been using you all along.
In one point I was thinking in my head, wouldn't it be great to just leave it up to the parents' decision? But I guess you can't, have one rule or another. And
Well-
3-year-olds don't necessarily understand that it's okay for this one to have it and this one not. I mean, it's a different population than working with a 15-year-old, right?
Well, that's absolutely true, but but in fact, it really is, and it has always been up to the parents to decide whether or not they wanted their children to be masked. We don't have a policy that says if your child isn't masked, they can't come to school. We have a policy that says we will strongly encourage children to wear masks. And that's what the Department of Early Education and Care led with at the beginning of the pandemic, that we didn't want to force children who had a terrible difficulty with wearing masks to wear masks, but we wanted to strongly encourage and use that as a teaching moment, and to use the classroom as a place to encourage children to wear masks. So it's never been 100% required to attend Concord Children's Center, and different centers, different preschools have different rules. But our parents have been very, very supportive of sending their children in with masks, and we've operated on that kind of community support, that it was watching out for the whole community. The environment is changing around COVID, and there are families who would very much like to see masks taken off. There are, I guess in answer to what you were saying, Jill, it could be, that we make it optional for families, and we give them we institute a practice whereby parents would give us a written request not to strongly encourage their child to wear a mask.
Mhm.
It sort of opens the door. So how far I want to go with that, what I want to tell my families about what our community is suggesting about masking a 2 to 5-year-old population, that's kind of what I was looking for, if that makes sense. And I know this is not, nobody has yeah.
Right. Does hearing what happened at the middle school change this for you?
Oh, it's just, it's 500 people at a father-daughter shamrock dance. That's a lot of people, but it's a lot of people playing together and being in close quarters, and that is what our children do in the preschool. I mean, that one of the benefits of masking at the preschool level is we're not as concerned with the distancing, which is quite frankly impossible with young children. But if the case counts are so low, and you all are saying really it's a reasonable thing to do to make it mask optional, I would listen to that. If you're saying no, we just had this huge outbreak at Peabody, we don't think that's such a great idea, I would listen to that too. I'm looking for some input.
I mean, my thought is to make it optional. You know what I mean? I mean, if not now, then when are you going to do it? You know what I mean? The case counts are low. We're getting, past flu season and all these other things, and like, you can try it, and see what happens, see what happens over the next month. But I think if your staff are vaccinated and they're healthy, like, and the kids should be coming into a healthy environment in the school, right? I think it's good for kids' mental health, even, you know, and even the wee ones, I think it's good for their mental health to have their masks off and see smiling faces. So, you know, I would make it optional, and if parents don't want to, then that's fine too. But I would try it. I would.
And it looked like many of the other preschools in the area had dropped mask requirements. And have you had any, is there any word on how that's gone? Have there been any outbreaks in those schools?
Well, our preschool groups are meeting tomorrow, so I don't have any fresh information about that. A lot of the preschools were waiting till the 21st to drop. Some of the, and I'm in touch with preschools around the area. Most of them were waiting till closer to the end of March, further away from February break, to make a change. And many of those preschools are not making a change. So there's nothing black or white about this. It's all pretty gray.
Mhm. Well, I would agree with Deb. I think it's important to have it optional. I also feel the 2-year-olds with a mask is, there's a lot of handling of the masks and pulling them off and on, and basically contaminating more than if the mask was on. So that's my thought.
Yeah. Any other comments from the board? Yeah. I mean, you know, my sense is similar that, you know, you can always change, you can always return to a mask required policy. You try it, you see how it goes, you hope for the best, you hope that these kids don't have that, if they get sick, they have very mild illness, and that they don't have older siblings or other frail people in their households. But those families are most likely the ones that would choose to, you know, put their child in a mask if there was somebody more vulnerable at the home, I would hope, right?
So, Jill, what I'm also hoping for is that the public health department sort of have a speaks with a voice around this. Tricia's been burdened with all of our questions and all of our desires for direction, and I'm you know, and that's great. I'm with the Department of Public Health's expertise in public health. I'd like to tap into that as well.
And which is, I'm glad you reached out, and this is, you know, why you're here now.
Yeah,
you know,
yeah.
you don't have a definitive answer. I mean, we're doing the best we can without, you know, full staffing in the department right now.
Absolutely, I totally understand.
Yeah, so, you know, you're welcome to reach out again. And you know, again, we can't make, you know, we can't set the
Totally
policy for you.
right.
But hopefully this is useful input. I think it's more common sense input. I mean, that it's just like, this is the time to try it, as Deb said, when case counts are so low, and see how it goes.
Yeah.
You know, it's all, right now, it's all a crapshoot with every population. So.
Can I just also let people know, right before the meeting, I ran the last 14-day Maven report in Concord and Carlisle for kids under 5, and there are 0 cases in both towns. And again, they're not home tests, but I haven't had that in a while. So
that's great.
That is
wonderful, yeah.
So I don't know, you take a chance, see how it goes. But that's all. I mean, I think that's what we're all doing as we go about our world now, and we start taking our masks off. It's all, you know, we're all kind of like tiptoeing out into the world again and taking our chances, and hopefully we all stay really healthy. So I think that's the best we can do at this point. All right, so I do want to move on to the messaging part, which is, I think when you saw our agenda, you saw public health messaging around that. And it was a little different what we had in mind for that part of the conversation, which is that, you know, I think prior to COVID, most of the work of the health department and the Board of Health was either totally unknown by a good part of the population or not fully understood about what public health is. And then COVID comes along, and we are the regulators. We are the bad guys. We're the ones that are setting, you know, these policies that make a lot of people unhappy, not everybody. But, we also are the ones that are, out to make life, as some people might perceive it, difficult for food establishments. That's not our intention to make it difficult. We're out to protect the safety of the public. We're out to prevent underage substance use by our alcohol work and our tobacco work. But a lot of this ends up creating a negative perception of what the health department is. And at the local level, in a town like Concord, where for the most part, we have a healthy community, and we don't have a whole lot of, the quality of life is high, and we don't have, we have a healthy community. Our rates of chronic disease are relatively low. On many indicators, we come out healthy. But public health becomes the punching bag. Karen and Gabby and Casey probably had a lot of vitriol thrown at them because we are perceived as the regulators and the bad guys on this. And, we don't have in Concord, outside of the Healthy Concord project, which Susan and I brought on in 2011, Marcia maybe it was even before that. There's been very little done in terms of prevention and anything that's perceived as kind of like positive. And so I just want, we've been really trying to think about how can we go about kind of changing the perception of public health? How can we let people understand that what our best interests of the community is what we're thinking of, that we are trying to create a healthy place for everybody, and that we're really acting in our best interests. Some of it is regulatory, and some of it is, most of what the public sees as regulatory. But we just want to change the conversation, and just wondering from the rest of the board or others, what are the ideas for getting this more positive view out there? And Gabby, did I kind of capture that right? Because we've talked about this a little bit. Did I misrepresented or represent this conundrum properly?
No, I think you pretty much hit it on the head. The work we did with the Healthy Communities grant, I was in on it too. It was an opportunity to work within the community for the benefit of the community in response to community needs. And maybe I don't know if we'll have the opportunity to do that in the next year or so, but I think it was very powerful work, and gave us a very different opportunity. I'm hoping that we'll have that opportunity again. And I think Jill and I talked about this. The work that we came about was mental health and mindfulness and a bikeable, walkable community. And those things are still applicable now.
And
very
more front and
positive.
center. They're like they were very much the priority areas that we identified 12 years ago, 10 years ago, and they're so much front and center right now. So
right. And this was all through community input. They were surveys, and so I think maybe it's a place to start now as to what would make the community feel like a healthy community, and how does the Board of Health and Health Department interface and collaborate with moving forward. And I'm sure it would make the work of the board more interesting as well. I know you love this stuff, but.
Right. I don't know. And, and it used to be that I think there was more robust local journalism to get the word out. And I am not even sure what are our outlets for communication at this point. Any thoughts? Ray, it looks like maybe you unmuted, so you have a thought on this.
I think this is sort of universal in terms of people's maybe lack of appreciation and certainly lack of understanding of what public health is all about. So I don't know if it's necessarily unique to Concord at all. And I think we probably do a better job here. And I think there's probably more acceptance from residents here than in many other communities. But I think maybe how do we change the tone, and how do we help people understand what public health is all about? And maybe it's a communication plan. I know the Healthy Communities movement, 10 years ago was an attempt to do that. That is 10 years old. And there's been a lot of things that have happened since then. But maybe some type of a communication plan. I thought that the collaborative that we received that $300,000 from the state, I thought there was a communication person built into that. And that might be, that's a resource we might want to tap. But maybe things like front page stories in the journal, editorials in the journal on a regular basis. Maybe something that Emerson can help us with in terms of their various newsletters. But really look at a campaign, if you will, about trying to help educate people about what we try to do in public health. And we don't always get it right. And it seems like 50% of the time we have people on our side, and 50% of the time we don't have people on our side. It's no matter what we do. But really talk about that kind of dilemma and just raise the public awareness. And certainly the town's website is a vehicle to do that. But we might want to think of multiple vehicles to get that message out.
Yeah, I think that's kind of what I was thinking, and I just wasn't even sure like who's reading what these days, and it's not like News and Notices is a place for like editorializing, it seems. It's really about getting alerts out for flash flooding or sewer work or.
Well, maybe another thing is social media, and I forgot to mention that, but I think that's really powerful, and figuring out and how can we tap into social media, various forms of social media to get that message out.
Does the town, maybe Marcia, this, does the town have a social media account? It does, Karen? Yeah. Okay.
Yes, it does.
What do we have? I don't even know.
We have both Facebook and an Instagram, and I think a Twitter account. We coordinate with the public information officer, Erin Stevens, to get that information out through those venues.
Uh-huh. And would we be able to tap into that if we chose to?
Absolutely. You also have the Minuteman network, the Minuteman Media Network. So you can do video, and you could put some things together that way and have short things available. I don't know if we're doing TikTok yet, but there's always a first.
Okay, thank you. Any other ideas on how do we change the perception? And I agree, Ray, that it is like it's not unique to Concord. It's every public health department has suffered for this. So,
Marcia and Gabby, may I ask you a question? Is Kelly on the Great Meadows thing? Isn't she going to be a public coordinator? Is that what Ray was talking about? The public relations person? Is that what
That would
Kelly?
be
She's the grant coordinator. She's not. She is helping.
She's
design a communications program for the collaborative.
Okay, she's not that person. Okay.
but it's probably to do stuff like, information on like Tripoli or tick preparedness or whatever, right? Like the shared public health concerns, or is it broader?
Well, not that, because we'll be bringing on a public health nurse and public health inspector, like a food service inspector, although we're already doing a lot of that because we already have the program in place. So so I think it's a little broader than just specific like ticks and Tripoli and so forth.
Okay. Okay, great. So we can think a
We
little.
can bring that up. The meeting, there's a meeting tomorrow of the shared services, and that's something we can query tomorrow.
That'd be great.
About whether that was the vision for the public health messaging person, whether it would be about promoting public health or just simply smaller initiatives.
Yeah, that would be great if it's somebody that we could tap into to help us with this messaging and using.
Well, this is very future thinking because the position hasn't been developed yet or a person hired. So in the future.
Okay. Anyway, I want to move on, but I just, I put this out here for us to begin thinking about, and maybe over time, I have lots of ideas on kind of some of the messaging that I think would help, and I'm easily able to write one of those, an editorial about kind of like that misperception of what public health is. Gabby and I could probably do a pretty good job of that, but I think maybe it's really coming up with a strategy and a communication plan, as you say, right? So I think, we can continue to talk about that over time. Should be great. Great, thank you. Board member reports. Does anybody have anything to report? If not, I do. I do anyway, which is that, so I mentioned earlier that I was on the chairperson's breakfast today, and there was lots of conversation about preparation for town meeting, including that if there is a warrant article that pertains to any of our committees, that we need to provide input into our either recommendation or input into those warrant articles. And of course, the health department is within Article 37. I did not, honestly, I hadn't looked at the warrant until today when I was like, okay, maybe we better see what we're in for. Article 37 is a citizen petition to authorize the select board to petition to impose a checkout bag charge. And this charge will, will be established by regulations to be duly promulgated by the Concord Board of Health, that we, the health agent, will have the authority to enforce this law and any regulations, and we may adapt and amend rules and regulations to effectuate the purpose of this law. So we need to take a look at this at our next meeting. I'm just pointing out now that we do need to pay attention to this one, because it's like every other unfunded mandate, like the bottle bills and everything else, and the polystyrene, where the health department is being asked to be the regulator on this one. So,
and if I may, I think we need to point out that the plastic bag ban is the responsibility of Public Works, not the Board of Health. And this sounds like comparable to what Public Works should be doing, not the Board of Health, because there's no health issue here. It is simply a sustainability issue. So I think they have designated the wrong group to enforce.
So do we tell them that now and not even discuss it further?
You could say you oppose it, or you could say we don't support it because they identified the wrong group responsible, and that they need to either change it, or that you can say that you don't support and would recommend that it be denied.
Yeah, I would agree that it doesn't seem, it just seems like one more kind of burdensome task for us. This was the petition is to basically to set this fee. It's interesting. So it's setting this fee, and the fee gets to be kept by the stores. It's to reduce some of the cost to the stores, but the enforcement falls on the Board of Health or on the health department. So it does seem really misplaced. So
I agree. Yeah, it's really not our purview, and I don't think we want to get into that. I don't see a health issue at all. So
no, we're not even inspecting the bags. They're just collecting a fee. So it makes no sense. So I can follow up with the town moderator to let her know that this one's nuts for us.
Yeah,
it doesn't belong here. So Marcia, your sense is that it's DPW.
Well, it's on the warrant, so it can be moved to town meeting. So you do need to take a position on it. I think you need to send a strong message that you are not the appropriate agency to enforce.
Okay.
Should I send? I'm sorry.
I don't think we have regulatory authority over something like this. Nor did we have it over polystyrene, nor did we have it over water bottles. But we didn't take a stand on those, but I think it would make sense to remind the moderator that we don't have statutory authority over something like this.
Right.
And
Marcia, should I send the board the sheet that says the different ways to take a position, or I oppose, or do they have to write a letter to the moderator, or do they just have a conversation?
I think they should have a conversation, then take a position. And that might be something that you would vote at your next meeting prior to town meeting. But I think having the conversations with the town moderator sooner rather than later would be very appropriate.
I can reach out to Carmen tomorrow, but we can also pencil this in for our April agenda.
I tried to correct people's perception when they were discussing this at the, I think it was the select board public hearing, but my messages, I wasn't recognized in the audience. They ended the meeting before I had a chance to speak, and no one made the correction in time. So 2 people spoke incorrectly about who was responsible for bags. So I'm sorry that I didn't get there in time.
And I'm just glad that I looked at this today, because if I had, I wouldn't have noticed it, and we would have gotten, if this gets approved, we would have just been put in there. So Marcia, your opinion is that it belongs at DPW?
Well, that is who the agency who enforces the plastic bags ban. So I think that they would be the same group that would support, handle a fee.
Mm-hmm. Yeah, and the fee is going to the stores. It's not even getting collected for, anybody. It seems like, shouldn't they police themselves? Anyway, it's one of those things that they didn't ask us. Okay.
There is a recycling coordinator or a position of a recycling coordinator. I don't know if it's filled right now, but that person helps coordinate some of the recycling efforts that are going on in the community. And I think this is along those lines to reduce the amount of waste, to promote recycling and so forth. Mm-hmm. And really that's the purview of that public works person.
Okay. That's helpful.
Other thing is that other towns and cities, I think, have bans on, plastic bags, and I think the city of Boston instituted a fee for a paper bag when you shop. So I guess we could find out, who's regulating that for the city of Boston. I mean, we can't be the first people to do this, you know what I mean? So I imagine this is coming before town meeting because, someone's seen it done in another town, and so I think, we might just look and see where other towns have this in place and what the enforcement department is.
Mm-hmm. And we can maybe do that. Well, I'll see what the response is when I reach out to Carmen and then see how much research we have to do prior to an April discussion on this.
Jill and Gabby, the Mass Association of Health Boards, Cheryl Sabara, would be, she's a lawyer, and there are a couple of lawyers on the staff there. She might be a great resource to turn to, or the Mass Municipal League as well, just to get a sense of what other communities are how they're dealing with sort of similar issues. And I think they would have a good understanding. And Cheryl knows the Board of Health regulations, the Massachusetts general law regulations. So she'll be a resource on that as well.
Okay, thank you. I'll reach out. Okay, to be continued. Okay, staff reports. Marcia?
Yeah, I just want to report that we've completed interviews for the public health director, and we will be reviewing, calling about references next, and so and then making a recommendation to the town manager. So I'm not at liberty to give names, but we are moving forward, which is very exciting.
Good.
Thank you. And anything else from other staff? Gabby, is there anything? You're on here.
I don't think
Yeah,
so.
yeah. I thought you were gonna talk about the 99.
Oh, right. We have a new restaurant coming in the old 99 building. And I met with them on site last week, and they'll be submitting their plan review applications and licensing. I expect them not to open until maybe June is what they're projecting. They're doing a large renovation over there. But that's exciting to have sort of the hub of West Concord in the old 99 there occupied again.
You bet.
So that's very exciting news.
It is.
Do we know what type of restaurant or anything about it?
It's the parent company is the local, so I think they're looking at mid-range, somewhere in between the 99 and Woodsville Table. The vast expanse in between those two places. Yeah, so I think it will be a sort of middle road, fine dining kind of place with a
Good.
pub atmosphere, is what I'm hearing.
Sounds like you read the marketing materials. You know.
No, I didn't.
Are camp applications coming in? Are things like that heating up compared to other summers?
Absolutely. It's all starting to bubble to the surface. I'm also working on currently, I'm working with planning and building on creating a guide to opening a restaurant. We're updating that information and working on the website for the White Pond watershed that will be where we are updating information regarding the cyanobacteria and the new APOD technology, as well as other areas of the watershed. So that's exciting stuff. And I think Susan, I think you all know Susan is going to be the special project manager for some data analysis on that project.
I saw Susan virtually yesterday. I was attending the Emerson Hospital Community Benefits meeting, and she was there because she's actually helping them do some implementation of their community benefits plan, because they have a lot of different moving pieces to it, and they needed a little bit of help, so they tapped into Susan. So it was nice to see her there.
Right.
And yeah, that was great to see her. Great. It's good to know that we have not lost that expertise in town.
That's right.
For either area.
Did you all see the tobacco information that I sent along?
Yes.
Great.
We had no sales to minors, all 14 establishments.
That's
Surprise, surprise
That's great.
checks, and they all complied.
Nice.
Yes,
It's a relief
nice.
that some of them had been repeat offenders previously.
yes, sir.
So
Yeah, yes, ma'am. Yeah,
that's really
that was
nice.
good news.
Finally understood it. That's great. Okay. The calendar. Our next meeting, I think, is April 26th. Right?
26. Yeah.
April 26th. Does anybody have any conflicts with that?
That's after the school, what am I talking? That's after school vacation. The week after school vacation, we moved it to accommodate it. Is everyone okay with that date still?
Yep.
Good. Thumbs
Yep.
up, okay.
And May 17th and June 21st.
Mhm.
Okay, so we're good on that. And then there were a couple of minutes. We had the December minutes.
December 14th, 27th, and January 20.
It was like the 21st.
Fifth. And they've all been reviewed, edited, tweaked.
So are they ready to be approved? Everything's
Yes.
good? So remind
They
me.
are.
Karen, there was one, I emailed you one thing that, in the January ones, you had accepted all my edits, but then there was one little comment to you, was just to
Oh.
confirm a name. So anyway, so the final version just would be without those brackets and
Okay,
question.
okay.
Oh, and was that the same one where I had sent you? I didn't, yeah, you got my comments. Okay. Because the attendance was what I think was wrong there.
Yeah, I know. I put Ray in there. I thought I'd want him there, even though he wasn't.
Mhm.
So the
Had you
minutes,
voting, Ray?
the minutes are good. And do we vote to approve those? That's what I forget.
Yes, you do.
Yeah, but I'll move to approve all 3 sets of minutes.
And,
I second.
and all in favor?
Aye,
Aye,
Hi.
aye.
Ray, Deb,
aye.
Mark,
I
both. I think we're good, Karen. We all, I think, raised our hands and said aye.
Thank you.
Okay, and then the final thing, which I hate to say, is that this is Alma's last meeting. And I'm very sorry that she will be leaving us, because Alma, you've been such a solid, reliable, steady voice here, and really appreciate your perspectives and your thoughtful words, and hope that you don't miss us too much when you scale back your activities. I know you said that that was one of the reasons you wanted why, but I don't know. This is hopefully been a good use of your time for you, because it certainly has been for us. So thank you for your contributions to the community in doing this.
Well, I must say I have totally gained by being on the board. I just love seeing how amazing each person is in regards to contributing to help the town. It's just wonderful to have had the opportunity to be part of supporting the town, which is just a great town. And I can see with the like of these boards, how come that's the case. So yes, I'm cutting back. Having had a big birthday 2 days ago, I think it's time to cut back on some of my overdoing. So, but I want to thank each person, and I really respect each one and have enjoyed getting to know you, and a little frustrated over Zoom, but
I know, we can't even give you a hug.
there you go. But I know I'll bump into you guys around, and that will be good.
I hope so.
And thank you all.
Pleasure, Alma.
Thank you.
Thank you.
Along those lines, I know, Karen, that you had reached out to the town manager's office.
I did, and I reached out again. I have not heard back.
And when I
as
was,
of- and I was talking with Chris this evening, and I have to admit, I forgot to ask him this evening. I did ask him the other day, but I will reach out to him again tomorrow to see if there's any, Russia, I don't even know what they call it anymore. I mean, I haven't had to do
Volunteer
this.
cards, volunteer
Oh,
cards.
now they're not green cards, they're volunteer cards.
Right.
Okay, so I knew it wasn't politically correct. Okay, volunteer cards.
and
So I'll
you know,
get,
go ahead.
and I had asked, obviously for people that were, if they were interested in the Board of Health, but really just anybody interested in serving, on a town board, if you might be able to take a look at.
Yeah.
It would be nice to have an RN, but
Terry Ackerman this morning mentioned that she thought there were 2 cards or 2 people that have submitted cards, and she was also going to check on the town manager's office. So that was this
Okay.
morning's comment, but and I also mentioned it at the Emerson Community Benefits meeting yesterday, particularly asking for, a clinician of with, a clinical background to, if they were a Concord resident, to let us know. That was a good way of, I think it serves Emerson well, probably, to have, besides Dr. Green, station here. So, but so far, I do fear the loss of Ray at the end of this as well, at the end of this year. So hopefully everybody else stays present and interested and willing. So,
It's not going anywhere, so.
thank you.
Thank you.
No,
Yeah, so I will definitely do that tomorrow. I will do that in the morning. I might do it before after we get off the meeting, so I don't forget.
great. Yeah, no, I'm really curious to see who else is out there that can help us. Because it's always interesting.
Mm.
Okay, I think if there's no other business, that's all that's on the agenda. And if anybody else has anything. But otherwise, I think we're good for another month.
Well, I think, Jill, I think you said great words about Alma. I think we should take an official vote. I would move to just, thank Alma for all of her service to the town on the Concord Board of Health.
Second
Thank you.
that.
I will second that.
Yeah, I totally agree. Yeah, it's been a pleasure, Alma.
Well, I appreciate you guys so much and thank you.
Yeah, I'm sorry that we can't give you a hug like Karen said.
I know, but I'll throw you all a kiss.
Well, thank you for your service, and thank you all, everybody, and I guess we can adjourn.
Yeah.
Motion to adjourn.
Yeah.
All right.
I second.
All right.
All
Hey,
right.
everybody.
Good night.
Thank you
Hey.
all.
That was like record time. Woo.
There.